Upholding ethics is a cornerstone of social work. Social work is a profession deeply rooted in values and ethics. It's not enough to simply want to help people. We must always act in an ethical manner. This is especially important when we work within organizations, where our decisions and actions impact not only our clients but also our colleagues, our employers, and the wider community. Ethical practice guides us to navigate complex situations, build trust with those we serve, and uphold the integrity of our profession. Imagine a social worker employed by a hospital. They are tasked with helping patients access resources upon discharge. However, the hospital's policies may sometimes create barriers for patients in need. This is where ethical decision-making becomes crucial. The social worker must balance their obligation to the employer with their commitment to advocating for the well-being of their clients. Ethics provides a framework for resolving these dilemmas. Codes of ethics, such as the NASW Code of Ethics, provide guidelines for ethical practice. They emphasize values like service, social justice, the dignity and worth of the individual, the importance of human relationships, integrity, and competence. By adhering to these principles, social workers can navigate challenges with a commitment to ethical conduct. Organizations as clients present unique ethical challenges. Social workers often interact with organizations as clients. This might involve advocating for policy changes, developing programs, or providing training. These interactions come with their own set of ethical considerations. It's important to remember that our primary responsibility is to the well-being of the community and the individuals we serve. For example, a social worker might be hired by a corporation to develop a diversity and inclusion program. While the corporation is the client, the program's ultimate goal is to create a more equitable and inclusive workplace for all employees. The social worker must ensure their recommendations align with this broader ethical goal, even if it means challenging the corporation's existing practices or policies. Transparency and open communication are vital when working with organizations as clients. We need to be upfront about our ethical obligations and how they influence our recommendations. We also need to be mindful of potential conflicts of interest. For instance, if a social worker has a personal relationship with a member of the organization, they should disclose this and consider recusing themselves from the project to ensure objectivity. Ethical collaboration is key to fostering trust among colleagues. Social work is rarely a solitary endeavor. We often work in teams, collaborating with colleagues from diverse backgrounds and disciplines. Ethical practice in this context involves treating our colleagues with respect, honesty, and integrity. Open communication is essential for building trust and resolving disagreements constructively. Imagine a situation where a social worker discovers a colleague is not documenting client interactions properly. This could have serious consequences for client care and could even put the agency at risk. The social worker has an ethical obligation to address the situation, but they also want to preserve their working relationship with their colleague. In such cases, it's crucial to approach the colleague directly and respectfully. Start by expressing concerns privately and seeking clarification. If the issue persists, it may be necessary to involve a supervisor or ethics committee. The goal is to resolve the situation ethically while minimizing harm to all parties involved. Section 4. Guiding future professionals. Ethical supervision and mentorship. Supervisors play a critical role in shaping the ethical development of future social workers. They provide guidance, support, and accountability to supervisees, helping them develop the skills and judgment necessary for ethical practice. Supervisors have an ethical obligation to create a safe and supportive learning environment where supervisees feel comfortable discussing ethical dilemmas and seeking guidance. Consider a scenario where a student intern is struggling with a particularly challenging case. They feel overwhelmed and unsure how to proceed ethically. A supportive supervisor would provide guidance, helping the student identify ethical considerations, explore potential courses of action, and develop a plan that aligns with ethical principles. Ethical supervision also involves modeling ethical behavior. Supervisors must demonstrate integrity, accountability, and a commitment to ethical decision-making in their own practice. They should also be willing to address their own mistakes and use them as learning opportunities for their supervisees. Section 5. Balancing obligations ethics towards employers. Social workers also have ethical obligations to their employers. This includes fulfilling our job responsibilities to the best of our abilities, adhering to agency policies, and using agency resources responsibly. However, these obligations should never come at the expense of our ethical responsibilities to our clients and the broader community. Imagine a social worker who becomes aware of unethical billing practices within their agency. They are torn between their loyalty to their employer and their obligation to report the unethical behavior. This is a situation where professional ethics must take precedence. Social workers have a duty to advocate for ethical practices within their organizations. This might involve raising concerns internally through established channels or, in cases of serious misconduct, reporting to external regulatory boards. Ultimately, our primary responsibility is to uphold the values and ethics of the social work profession, even when it requires difficult decisions.